Welcome back. Every Monday this May, WLOX is highlighting a variety of mental health services and their importance for patients. Mississippi's largest treatment center for psychiatric and addiction treatment services is here with us in the studio to talk to us today. Dr. Leah Claire Bennett with Pine Grove Mental Health and Addiction Services is here to tell us more about all of their comprehensive treatments. And you guys do a lot over at Pine Grove. Can you kind of walk us through the process?
Yes, we do a lot. We actually have 5 levels of care at Pine Grove, starting with the most acute, which is our inpatient unit. That's usually a 5 to 7 day stay for people who are either psychotic or suicidal and really need intensive services.
Right.
So that's a shorter length of stay. The next level of care is our residential. That's usually what people refer to as rehab when they go to rehab. But we treat both mental health and substance use disorders in those programs. But you can go, average is 30 to 90 days, but it's an extended length of time for treatment of both of those disorders. We also have our intensive outpatient, which is for substance use disorders. That's where people, when they need to continue to work, can get substance abuse treatment and be able to work while also getting treatment. You're getting 9 hours of group a week and an individual session per week.
That's important.
And then our partial level of care is really one that a lot of people don't know about. It's a more intensive, so before you drop into outpatient services from a more acute stabilization, you may need services every day. And so people can come for about 6 hours of therapy a day. They come Monday through Friday, and they get to live at home. And so that's a nice option for people that really need more than just a once a week session, but it offers psychiatric care as well as therapy.
Yeah, that's great. And I mean, you guys have seen some notable people too in the past. You've heard of celebrities coming to Pine Grove for care. Why do they choose Pine Grove?
Well, I think we have excellent care and have offered that for many years. Our standards of excellence, I think, have been really pushed through the years, and it is something that we all strive for. And we want to be known as a place in the Southeast region that people can come for mental health care. And so working hard for that and holding on to that is really important for us.
What are some of the biggest issues you're seeing day to day from people now?
Really, I mean, it depends on kind of which area you're in, but I mean, a lot of people are struggling with substance use disorders. There's an increasing use of crystal meth again, which we didn't see for a while. And then also just the ability to cope is such a core issue for individuals, and it leads to significant mental health issues. And that seems to be really at the core, which is also another thing that we're seeing a lot of is trauma, and so that can be a condition that needs a lot of emphasis as well during the treatment process.
And I feel like mental health and addiction do go hand in hand. Too often you see facilities mainly just focusing on one or the other. How important is it to encompass both in an all-in-one?
It's essential to really do the treatment concurrently, right? Because if you just treat one, when the person gets out, the other condition is still going to be alive and well. And so to be able to address both at the same time is really critical for the person's success.
Doctor, and if people are looking to get treatment, maybe to come to Pine Grove for that, how would they go about doing that?
They can go to our website, which is pinegrovetreatment.com, or they can call our 888 number, which is also online, and we'd be happy to assist them and to get them into the services that they need.
Some great information and important work you guys are doing too, so we thank you for making the trip out to talk to us.
Thank you for having me.